I'm Connie Trimble. Today I'm going to tell you some good stories about cancer interception, which is preventing cancer by identifying and treating the precursor lesion. In this case, HPV. Cancer is caused by HPV. Now, many of you, HPV remains very, very common despite the availability of preventive vaccines. And one of the avenues which my team works on is treatment vaccines to treat existing high-grade intraepithelial lesions. And that's going very well. We've made disease disappear in about 2/3 of our patients, so stay tuned. But the thing I'm going to spend most of my time today talking about is something new, and it's non-surgical. Yeah, me, non-surgical. We have repurposed with France Viral Therapeutics a Chinese herbal medicine derived from the bark of the wormwood tree. It's called Artesunate. Now, the Chinese have been using this compound for centuries to treat acute malaria. And the person who figured out what the active compound was actually given the Nobel Prize in 2015. And many millions of people are alive today because of her work. Artesunate and related compounds are part of WHO recommended, World Health Organization treatment, frontline treatment for acute malaria, people who are very, very sick. We've given it orally as an IM injection, we've given it intravenously, and in little kids who are too sick to keep food down, we give it to them in suppositories up their little bums. All of which is to say that we know a great deal about the pharmacokinetics and the toxicity and safety profile of this compound when given to very, very sick people. Now then, it turns out that these pre-invasive high-grade dysplasias don't care for it either. The first clinical trial we did has been published. We targeted women who had CIN2-3, high-grade cervical dysplasia. And we tested 1, 2, or 3 treatment cycles of suppositories that were administered intravaginally by the patient herself. Each treatment cycle was 5 consecutive nights of self-administered vaginal suppositories. The most common side effect was itching, and the short version is we cured 2/3 of the patients. And part of the way through the trial, it was so clear that it was working. We also made a formulation based in an ointment and are using that to treat vulvar intraepithelial neoplasia, which many of you will know is a very, very stubborn beast. The current treatment is surgical mainly, and you know as well as I do that even if you get clean margins, the stuff comes back. And we're also using it to treat perianal disease, AIN, anal intraepithelial neoplasia. We're using the suppository to treat rectal intraepithelial disease. Now then, if you can imagine having a non-surgical treatment for disease there, that's mind-blowing to me. In any event, the trials are having very, very promising clinical results. The phase 2B for the cervical disease is open not at Hopkins, but at M.D. Anderson and also at the Cleveland Clinic. And those trials are open to accrual. Here at Hopkins, we have 2 current protocols for the Artesunate. One is we have, I opened a trial for a compassionate use protocol, and that's for women who have either recurrent high grades, you and I have those patients, people even who have completely intact immune systems and they have a CIN23, you take it out, and then it recurs, and you take it out, and it recurs again, and eventually you do a hysterectomy, because what do you do? And some of my patients have been dealing with recurrent high-grade dysplasia for 2 or 3 decades. It's also open for people whose immune systems are compromised in other ways, including solid organ transplant recipients, or people who have autoimmune disorders, or people living with HIV. And those clinical results are also very, very promising. Enough so, I can't tell you what they are, but enough so that we'll be filing an amendment to the IND in order to expand that protocol. Another trial that is currently open at Hopkins is Artesunate ointment to treat vulvar intraepithelial neoplasia. And the results there are very, very promising as well. This trial is also open at the Cleveland Clinic for a different site. We'd be happy to take questions or referrals or speak to you about any of this work. The best way to contact us is by email at cervixdoctor.jhmi.edu. And to see a more complete explanation of the therapeutic HPV vaccine work, you can go to YouTube and look up Kicking Cancer's Butt, which is a TEDx talk I did a few years ago, in which I spent quite a while explaining the differences between preventive and treatment vaccines, and it's working. So thanks for your attention, and I look forward to hearing from you